health.com. This is what you're going to see in a couple of months. And if you're a patient looking for a doctor, you can essentially go to the website, click here, and find a physician who is working, registered on the platform, and connect with them using the platform. For example, if I'm looking for a doctor in New York City, connection is a little slow. Basically, I just go here, and then I can see a list of physicians that are Hello Health doctors on the platform in New York City here. And it kind of maps the location, and here's a featured physician. All I have to do to make an appointment, click there, and I have an appointment with that doctor. So in this sense, it allows consumers, patients, connect with a doctor when they need one. And it's the way that we have the platform set up, we essentially guarantee the patient an appointment within 24 hours. So I'm going to log into the website and show you the doctor's side of the platform, because essentially what the system is for the physician, it's an integrated EMR and practice management system. In addition to being a set of social networking tools that they can use to connect with their patients. So when doctors sign up on the platform, they get an EMR, they get a practice management system, in addition to the ability to video conference, email, and do instant messaging visits with their patients. We currently have a medical practice actually in Brooklyn and Williamsburg, where we're using the technology for practice medicine. I'm an internist, and I spend about 60% of my time seeing patients right now using the platform, and the rest of the time on business and technology development side of things. So the web-based solution we have is really a comprehensive solution, both for the patient as a PHR system and for the physician as an EMR and practice management system, plus a social networking tool for doctors and patients. And I'll explain to you what that means. Okay. Add security. Scroll down, essentially. Just bear with me for 1 second. Apologize.
It's always fun to do live demos.
So you can see we're definitely HIPAA compliant. Okay, very good. So I'm going to log in as a physician and show you what the physician side of the platform looks like. And you'll get a better understanding of the social networking aspects of the technology. So I logged in as a physician, and my connection is a little slow.
Using the software kind of as you're your own data site? Is that the idea?
As our own data?
Data.
Okay.
You're your own first customer kind of thing?
Yeah, essentially. Actually, the way this started was, we started the medical practice, developed our own technology, and then started getting hundreds and hundreds of emails from other doctors who were interested in practicing this way. And we also had a tremendous amount of response from the consumer side, from potential patients, like, wanted their own telehealth doctors in their own city. So we actually have another medical practice that we're going to open in the So physicians can essentially sign up and start using the platform as their EMR and practice management system and start seeing patients and tracking the patients on the platform. For physicians, using the platform doesn't cost anything, it's free. The business model is that you just essentially take a percent of every transaction that occurs, happens on the platform. So here I logged in as a physician, and this is my dashboard, and these are these are the activities of my medical practice, basically. So as you can see here, these are my upcoming appointments, and on the right side, these are my appointments for today. And here you see little icons next to the times here, and these tell me what kind of an appointment it is. For example, this one is an office visit, this is a video visit, this is an instant messaging visit. So basically, when I set my own availability here on the platform, and patients can reserve a slot on my schedule on the platform to come and see me in the office, or communicate with me on the platform using video chat or instant messaging. So these are synchronous sort of visits that happen on the platform, and it's all in the same secure environment. So I'm gonna, when the patient comes, when I'm ready to see the patient, I essentially just click on their name, and I gain access to their medical record. And this is what I use to document the visit, basically. And
Nobody take pictures. It's private health information.
these are
I'm kidding.
So basically, so Jane has already described, her chief complaint, why she's coming to see me, and this is the documentation tool. Basically, I'm not going to go through the details, but basically what we have dynamic templates, which basically tailor themselves to the symptoms of the patient, so that all the doctor has to do is click a few boxes and document the entire visit. The whole idea being to streamline documentation and get that out of the way so that the physician can really just concentrate on managing the patient. So here there's a timeline of the patient's previous visits, and this is actually very helpful because it's a snapshot of all their past visits that happen on the platform. And if I want to go, say, to that visit, I just click on that dot, so I'm taken to that visit, and this is the current visit here. So you get a good overview of the patient's past history, and that ensures continuity of care.
In about 3 minutes.
Don't use any data. And so I'm going to go back to my dashboard, and there's also an email feature, and these are structured emails. So patients can send their physicians emails, and what's interesting is that the way we have everything set up in our practice in Brooklyn, and the way the system works is that the first visit can only be an office visit. We don't want to be virtual doctors. We don't want to be gimmicky. So once you establish a relationship, then you can really follow up online. A lot of the visits are essentially unnecessary, and we can reduce the number of unnecessary visits. So we're doing about half of our follow-ups, more than half, about 60% of our follow-ups online. And that includes coordinating the care of the patient with different specialists and chronic disease management. So it's not really just for convenience. It actually creates efficiencies in how you manage your patients and health information exchange between you and other physicians. And I'll show you what I mean by that.
One more minute, Sean, if you don't mind.
Sure. So this is basically just email, and these are structured emails. If I make a medical recommendation, it becomes part of the medical record. And here the patient is reaching out.